Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Thanks for being with us.
Hey, good morning.
I have to say, I was down at the University of Illinois last week dropping off my daughter, and these testing saliva stations are everywhere. They get the results in like 3 hours. You spit into a tube. Why hasn't this been going on forever?
Well, we don't have the capacity to do it nationwide. That's why. But the University of Illinois took it upon themselves to develop this test. Now, let's make it clear. Saliva is just the sample. The test is the test. All right, they're really two different things. This test works okay with saliva. Not every test does. So it's two different things. But the University of Illinois people, incredibly clever, they developed their own assay, and then what they did is they developed an app on the student's phone that when the student gives the sample and they scan the tube that the saliva is in, and then they scan their ID card, and when they run the test that night, it ends up back. The student gets the message about what's going on. It's really an incredible.
Yeah, and I think that app would also help in tracing. So how soon before all of us can go take this test?
Well, you got to go re-enroll in school and get down to Urbana, a very nice place. But this will expand. The other schools are going to pick up on this. You probably heard the other day that Yale University is doing a very similar thing. Rutgers University actually developed the first one. And this is going to pop up all over the place. And this is really part of the answer. Because if you can rapidly, like within 24 hours, identify everybody who's infected, get them quarantined, this whole thing will go down.
A new study that says you're okay.
Yes.
It's also odds of catching COVID-19 on an airplane, they say now, are slimmer than you think.
1 in 4,300 is according to the MIT model.
Now, didn't you say that was your biggest worry, is being on an airplane with all the circulated air?
Yeah, well, the circulated air, the newer airplanes do change the air. And so that's an improvement. The other thing is they've improved their filtering process. Now, this still assumes that everybody on the plane is wearing a mask. If the people take the mask off, that number goes out the window, and it's, the rate is bad.
All right. Let's take a look at viewer questions. Do we think cold weather will result in more droplets, making asymptomatic people more prone to spreading it? A lot of people get runny noses in winter normally.
Yeah, that's really not the issue. In cold weather, people congregate more inside. And that's really what the issue is. It's really not temperature related. It's the fact that in the cold, you're inside how can you be outside in the fresh air? You just can't. It's too cold.
See. All right, here's another question. My sister was sick in March but couldn't get tested and later tested positive for the COVID antibodies. Now her coworker that sits next to her tested positive for COVID. Assuming my sister is not reinfected by her coworker, can my sister still have infected us by not wearing a mask?
A little confusing there. But let's pull the story out a little bit. So your sister had COVID in March, or this person's sister had COVID in March, and that's why she has the antibody now. For at least the next couple months, she's not going to be able to get COVID again. She's got immunity, and we're learning more and more about the immunity every day. There's still nobody with a documented second case. All right, so we're going to watch that very closely. We don't know if the immunity lasts forever, but the more recent data looks like the immunity is pretty good. So, she should still wear a mask and be careful, but she's not at risk like somebody who doesn't have the antibody.
All right, Dr. Murphy, thank you very much. If you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow.
Thanks, Doctor.
Thank you.
Great. Have a good day.
You too.